I'm Dr. Deepti Rana, a senior consultant dermatologist at Max Hospital, Delhi, and my clinic at M&D Clinic, Noida, Sector 18. I have been practicing as a dermatologist for over 15 years now, and I have been seeing patients in dermatology, cosmetology, and all various types of skin issues. So the most common issues we deal with during a wedding season or winter season would be dull skin, dehydrated skin, pigmented skin, and loss of luster, and also very dry hands and dry chapped lips, and also pigmented lips. Freckling becomes common because people sit in the sun for long duration and they don't realize the harmful effects that could lead to a further pigmented skin or a darkening of the skin. That really needs to be addressed, because a lot of people think winters come, so we need to sit in the sun, feel comfortable, take the heat, feel warm. But that also leads to a lot of skin aging signs like frecklings, early wrinkling, and also uneven skin pigmentations, and also dehydrated dull skin, so early wrinkling especially around the eyes, pigmented lips. A lot of smokers could have that, or somebody who is like an athlete or is very dehydrated can have those dehydrated dull lips. And a lot of people do a lot of these makeups, which can lead to darkening of the skin, dull skin, and also not removing makeup well. Products that they use which are actually damaging the skin, and they really don't know what to be taken care of, how we can address that. So all those things really fall into a pit that we really need to work on, because most of it is educating a patient. So educating a patient, that is, must use a moisturizer, sunscreen, and always consult a dermatologist for the best form of treatments available. So all that really needs to be worked on. So we need to really work on parameters of lasers, type of laser, and what wavelength would go for what patient. So all those things depend, because Indian skin we can get really burnt fast. So there we need to really work on what type of skin, what type of wavelength, and what laser we need. So this is what we have currently with us to treat a lot of pigmented issues and a lot of brightening, glow, plumping up the skin. So this is the biggest toy that works the best in clinic. So suppose a patient comes in with me and says, okay, I have these dark lips and I want a little plumped up lips, but I'm too scared of injectables. So yes, this baby works really well. So we have this PT mode, which is the photothermal mode, that works very well in plumping up the skin. So also works very well for plumping up the lips. Also takes care a little bit on the pigmentation part, but with that we take care with the Q-switch mode, the Q-switch NDR mode. So these two modes in combination work excellently well for somebody with pigmented lips or smoker's lines and all those. Somebody who wants like a nice lush lip but are very scared of injectables. So yes, this is something that I really go to, especially a lot of brides. They want a nice lip, fuller lip, and especially before a wedding or an event, or somebody is going in for a proposal. So it works very well. Then we've really worked for freckling, which is very common, I think, all over India or in the Europe. Freckles are a big problem. I think Europeans love their freckles. Indians are not too keen of their freckles. So that's a problem that I've started getting these brown spots. What do I do? Nobody in the family has it. People are calling me pigmented. So yes, this works well on freckles, but yes, we don't do just one session. We need 2, 3 or multiple sessions to work on those freckles. But then good sun protection and preventing them from further occurring is by sun prevention, by putting some lightening creams, vitamin C and sunscreen. Then the other thing is the so-called glow. So this works very well. Also bleaches the hair, because there are pigmented dark hair, so bleaches well. Anyways, that 50% glow is there. Second thing, it just rejuvenates and brightens up the skin. So this has been an excellent